Living in Bellingham, Washington, we have access to amazing hikes almost all year round. However, sometimes hiking and walking can cause a lot of hip pain, tightness, and achiness, which kind of takes the fun and joy out of hiking. Sometimes that can be caused by trigger points in the deep hip rotators. So in this video, we're going to talk about ways in which you can kind of release and stretch out your hip a little bit using trigger point work right from your home, guys. Hey everyone, welcome to the channel. I'm a physical therapist from Integrative Physical Therapy in Bellingham, Washington. So Elizabeth and I love to hike. Truth be known, she loves to hike a little bit more than I do, but we do like to get out there as much as we can. And oftentimes too, Elizabeth will have a little bit of hip pain and tightness and she'll start limping a few miles into the hike. There is a little routine that she does that has helped her significantly in terms of improving the mobility, function, and flexibility of her hips. So we're going to show that to you. You need a few things first. If you're really serious about trying to keep yourself as active as you can and as pain-free from muscle and joint dysfunction, then you really need to get some of these trigger point tools at home. I'll put a link right up here to a video that has a whole list of the equipment here. But for this video, we're going to talk about you're going to need a lacrosse ball or a tennis ball, a basic foam roller, and then if you want to go next level, a foam roller that has ridges to go a little bit deeper. But first we need to meet the muscle so we can talk about what exactly we're trying to get after. I've highlighted the glute max, and everyone knows the glute max. And that can be a source. Remember, any of these muscles can be a source of tenderness. But if we reflect that away and go underneath the glute max, then it's going to reveal the glute medius. And then if we go behind the glute medius, we've got what everyone knows, the piriformis. What you don't see is a sciatic nerve, but the sciatic nerve traverses right by that piriformis. Then we've got the quadratus femoris. The reason for this is just to give you an idea of the complexity of the musculature that we have in this hip area. And remember, any one of these can be a source of pain, discomfort, and tightness. And there we've got the glute minimus as well too. Just a little tour, guys. Now remember, when you're doing trigger point work, it should feel a little face cringing and a little uncomfortable. We don't want it to be too hard where we're holding our breath, but we do have to kind of get in there and move some things around. So what I'll have you do first is start with the foam roller, because different people will have a different level of sensitivity to the glutes. Remember, like I just showed you, the deep hip rotators are located pretty deep. That's why they're called deep hip rotators, underneath the glute max. But what if I have so much tenderness that the lacrosse ball or the tennis ball is just too much? So we start with the foam roller. In this example, I'm going to be working my right hip. I'm going to come up onto my right hip and I'm going to do it a couple different ways. I'm going to start with my leg straight first, and I'm going to use my left leg and my arms to just kind of go all the way around the surface of that hip and just kind of get an idea of how it feels. Now for some people, this might be as deep as they can go. Now I've been doing this for a long time, so for me, this doesn't really give me a whole lot. But let's say it did. Then what you would do is you would find a sore spot, you're like, oh boy, right through there. And then I would work that for about 30 to 60 seconds per sore spot. Now you can overdo it, so you need to be careful. The next one you can try is a foam roller with some ridges. Now we're going a little bit deeper. So same thing, I'm gonna get up onto that hip. In this example, it's gonna be my right hip, and I'm gonna work it back and forth just like this. And you'll have to see, is that giving you that type of sensation here? So like for me, it's a little deeper and I can feel a little bit of that tenderness right into that area. Another way to do it is to cross your leg, and that changes the angle a little bit as well too. And you're just exploring that whole hip. Remember, there's a ton of deep muscles in through there. And so we're just gonna kind of get an idea, basically searching and destroying any tenderness that we have in that area. Eventually you're gonna progress to the lacrosse ball, and that's really where I want you to be at, because that is the best way to get into the deep hip rotators. So what you're gonna do is you're gonna lie down, I'm gonna move this leg over, and I'm gonna put the ball basically right into that area here, and then I'm gonna drop my leg down. And I'm gonna keep moving the ball around until I find the money spot. And this goes a lot deeper. This is going to go right into those deep hip rotators. Now, once I find a spot, if it's pretty painful, what I can do is I can just pressure on and pressure off for 30 to 60 seconds. If I can handle it, I can just breathe through it, focusing on my exhale and just kind of letting my legs sink down. That's going to push the ball deeper into that hip. but 30 to 60 seconds at the most. You might find 3, 4, 5 sore spots per hip, and that's fine, but you should only be spending then about 5 minutes total on each hip. Now it's critical when we're done is to go into a little bit of a stretch. And so I'll just show you some basic ways in which you can stretch your hip. First way we've all seen, cross your leg, use your arms, pull up this way, and that's going to give me a nice stretch in through here. I like my clients to hold their stretch for about 30 to 60 seconds. You can kind of rotate from side to side to kind of change the angle. Another way to stretch the hip in standing, you're going to need a chair or something pretty high. And I'm going to put my leg up through here. I'm going to try to keep my knee at a 90-degree angle. And then I'm going to drop down if I need to. Once again, I can change the angle here, but that's giving me a heck of a stretch deep right into that hip. I'm not going to bounce, I'm just going to hold it nice and steady. If those two don't work for you, you can just come to a chair, sit right at the edge of the chair, put your ankle on your knee, and bend up the support leg, and keep a nice curve in the small of your back so I'm not collapsing my spine. And I'm just going to lean forward, and that's going to give you a nice solid stretch in the hip. If you have some pretty significant soreness in your hips, understand that it's going to take about 2 weeks for the tenderness to start to subside. I recommend doing this little trigger point stretch routine if you can, anywhere from 3 to 5 times per week, and especially more frequent until the overall tenderness starts to settle down. As the soreness starts to settle down, you should see a nice change in your ability to hike and walk without hip pain. All right, guys, if you have any questions, please let me know. Go out, get your lacrosse ball, your foam rollers, and leave a comment down below. Let me know if it helps. Take care.